Welcome to the Centers for Medicare and Medicaid Services module, Section N, Medications. This module will introduce learners to HIS Section N, Medications, which includes items N0500, Scheduled Opioid, N0510, PRN Opioid, and N0520, Bowel Regimen. In this module, we are only going to focus on discussing specifications for the individual measures. Although items in this section are also used to calculate the hospice composite measure, we will not cover the details of that measure in this series. For more information on the composite measure, we recommend you review the QM User's Manual, which can be found using the link on the resource slide. This is the 6th of 8 modules in the larger series, HIS Coding Guidance. The series overall is intended for users who are familiar with HIS coding and submission guidelines. For newer users, we recommend starting with the HIS manual and older trainings first. These modules will not cover all items in all sections. Learners may choose to listen to the entire series or may choose to listen to one or two modules that are of most interest to them, meaning the modules in this series can be watched independently or as a group. Included here on Slide 2 is a list of acronyms that will be used in this presentation, listed in alphabetical order. After completion, learners will be able to identify the items that compose Section N, Medications, describe the intent of the measure, and the corresponding quality measures. The items in this section correspond to NQF 1617, patients treated with an opioid who are given a bowel regimen, and NQF 3235, Hospice and Palliative Care Composite Process Measure, Comprehensive Assessment at Admission. Section N gathers information on opioids and bowel regimens. The intent of the items in this section and the associated quality measure is about preventing opioid-induced constipation, not about whether opioids were initiated to treat symptoms or whether a bowel regimen was initiated to prevent non-opioid-induced constipation. The first item in this section is N0500, which collects information on scheduled opioids. Opioids are commonly used in the management of pain and other symptoms. N0500 reports of clinical documentation supports that a scheduled opioid was either initiated or continued, and if so, the date the order was received. For purposes of HIS collection, scheduled opioids can be initiated or continued for any reason, regardless of symptom, not just pain. Standing orders and comfort kit initiation is defined as the date the order was received by the hospice and there was documentation of instruction to begin using the medication or treatment. For orders continued from previous care settings, you should complete N0500 based on scheduled opioids for which the hospice has received orders. The next item in Section N is N0510. This item collects information on opioids as well, but is exclusive to PRN opioids. Now let's look at coding tips for PRN opioids. N0510 reports whether a PRN opioid was either initiated or continued, and if so, the date the order was received. As with N0500, the PRN opioid can be initiated for any reason regardless of symptom. Standing orders and comfort kit initiation is defined as the date the order was received by the hospice and there was documentation of instruction to begin using the medication or treatment. For orders continued from previous care settings, N0510 should be completed based on PRN opioids for which the hospice has received orders. Now that we have a general understanding of the previous two items in Section N, let's take a look at N0520, Bowel Regimen, and see how the items all come together and are ultimately used to calculate the patients treated with an opioid who are given a bowel regimen quality measure. N0520 reports whether a bowel regimen was initiated or continued, and the date of initiation or continuation. You would only complete this item if N0500A or N0510A equals 1, meaning the patient is on some type of opioid. So if the patient is not on an opioid, skip N0520, regardless of whether they are on a bowel regimen or not. At first, this skip pattern may seem strange, but if we think about the intent of the items in this section, it should make more sense. Remember, this section is exclusive to preventing opioid-induced constipation. So if the patient is not on an opioid, there is no need to report information on their bowel regimen. For non-pharmacological bowel regimens, for example, prune juice, report the date the hospice nurse or clinician discussed the intervention with the patient or caregiver. For standing orders and comfort kits, initiation is defined as the date the order was received by the hospice and there was documentation of instruction to begin using medication or treatment. To reiterate what I mentioned earlier, this item is a conditional item, meaning you would complete only if the patient is taking a scheduled or PRN opioid. It is important to remember that per the HIS instruction, if the patient is not on an opioid, skip this item even if the patient is on a bowel regimen for non-opioid-induced constipation. NQF 1617 is the percentage of patients' days treated with opioids that are offered or prescribed a bowel regimen, or there is documentation of why this was not needed. While the HIS asks about scheduled and PRN opioids, the quality measure includes only patients on scheduled opioids. As with the bowel regimen item itself, this quality measure is also conditional. This measure only applies to patients who received a scheduled opioid. If the patient is not on a scheduled opioid, they are excluded from the denominator. These patients are considered neutral from a QM calculation standpoint. For patients not on a scheduled opioid, whether you initiate a bowel regimen is irrelevant for quality measure calculation purposes. The initiation, or lack thereof, of a bowel regimen can neither count for you nor against you for these excluded patients. Again, we go back to the intent of this item and measure, which is exclusively focused on preventing opioid-induced constipation. If the patient is not on a scheduled opioid, their bowel regimen status is irrelevant for this QM, even if you did start one for non-opioid-induced constipation. To meet the criteria for the numerator, patients that are taking a scheduled opioid must be offered and/or prescribed a bowel regimen within 1 day of the scheduled opioid being initiated or continued, or there must be documentation as to why a bowel regimen was not needed. While the series overall is intended for users who are familiar with HIS coding and submission guidelines, information regarding the Hospice Quality Reporting Program can be found by clicking the hyperlink on this resource slide. This resource slide also contains hyperlinks to specifics on the HIS hospice quality measures, the QM User's Manual, and the HIS Manual V2 with the change table. The Hospice Quality Help Desk is available to assist with general questions about the Hospice Quality Reporting Program. This concludes the module Section N, Medications. This module included information on the items and quality measures in Section N, including the PRN and scheduled opioid items, as well as the bowel regimen item. This is the 6th of 8 modules in this series, Hospice Item Set Coding. The other modules in this training series are listed here, and we encourage you to view these training modules as well to understand more about HIS coding and learn how it may help you and your hospice. Thank you for viewing this presentation. The information presented was correct as of the date it was recorded. This presentation is not a legal document. Official Medicare program legal guidance is contained in the relevant statutes, regulations, and rulings.